RSV continues to fill up pediatric hospital beds, but kids aren't the only ones affected. Thanks for staying with us. I'm Glenda Lewis.
And I'm Brian Abel. Adults across the U.S. are also trying to avoid RSV if they're not already struggling to recover.
Yeah, according to the CDC, between 60,000 and 120,000 older adults in the U.S. are hospitalized every year due to RSV, and those numbers are pretty high. Dr. Nandy here with us now. And Dr. Nandy, tell us who's most at risk and why.
Yeah, and we've talked a lot about children, right, Glenda, getting sick from RSV and respiratory syncytial virus, and how pediatric hospitals are really filling up because the virus is spreading much earlier and faster this year. But RSV is actually more dangerous to adults. The CDC estimates between 100 and 300 kids younger than 5 die each year due to the RSV infection. But for older adults, that estimate is much higher. The infection can cause between 6 and 10,000 deaths yearly, and I think that's news for a lot of people. Now, here are the adults most at risk for severe infection: seniors aged 65 years and older, adults with chronic heart or lung disease, and adults with diabetes or weakened immune system. And now, why are these folks more at risk? Well, as we age, our immune system, which is a network of cells, tissues, and organs that really are there to defend our body against infections, can weaken. And adults who have chronic heart or lung disease and weakened immune systems are already compromised, so their body is not always strong enough to handle such an infection.
So are there treatments for adults, and where are we with a vaccine?
Yeah, important question, right? There are no specific treatments for RSV, but most of the time for adults, Glenda, it's a mild infection, and here are the symptoms: runny nose, loss of appetite, coughing, sneezing, fever, very familiar to all of us. For nasal congestion, adults can use an over-the-counter decongestant. And for coughing, as you know, you can take cough syrups. For those who end up dehydrated, importantly, or have trouble breathing, they may need additional oxygen, IV fluids, or in worst case scenarios, intubation with mechanical ventilation when there's a tube put in to help you breathe. If anyone develops serious symptoms, please seek medical treatment right away. Don't wait. In the meantime, remember to do some simple things. Wash your hands often. Wear a mask if you're at high risk. That's because RSV spread through coughing, sneezing, or touching infected surface and then touching your face. So we can do some things to prevent it. And remember, not just for kids, but for adults as well.
Yeah, keep up those clean habits.
Exactly. That's why we fist bump.
Yep. Right, exactly. Because we're both huggers. Thank you, Dr. Nandy.
Oh, my pleasure.
All right, and if you have a health question for the good doctor, you can email him at drnandy@askdrnandy.com or send it to us today on Facebook or Twitter, and we'll get it right to him.